Hello guys, happy Wednesday. So if you didn't notice, my surroundings have changed. I am back in the office. I'm super excited. So for all of you that are concerned, we are wearing masks. I just happen to be in a room all by myself, so I finally get to take my mask off so I can get some fresh air. So if you're with me last time, I know we talked about the hair solution that you can microneedle into your skin to help beard growth, to help thinning hair. Well, today I thought I would kind of stay around the same theme. So we're going to be talking about the AnteAGE Microneedling Solution. Now, this specific skincare is for your skin. So it has stem cells derived from human bone marrow that is copied in a lab. And it also has two other types of stem cells that have helped fortify the solution. So it's gonna help with inflammation, it's gonna help with collagen production, and this is something that you can dermaroll into your skin. So one of the items that I have with me this is our in-house derma roller. Of course, this is the sample that we show everybody, so I'm not gonna be derma rolling my face today, guys. But one thing I wanna show you is these rollers, they're very easy to use, and if you can see, I don't know, sometimes you can kind of see those needles on the end of this roller. So this is really where the magic happens. So what the process is to derma rolling your skin, and I'm gonna show you, sorry I don't have my typical. So this is what the vials look like inside of that box. So this is concentration of stem cells. Shout out for shout out for Black Lives Matter, guys. So there's been a lot of protests here in LA, and we are so for it, especially the peaceful ones. So, Black Lives Matter, guys. So, the AnteAGE solution comes in this vial. And it has this awesome roller, which means you can really, really get to the areas that you want to derma roll. So it's really easy. I'm not going to put this on my face because, again, this is my demo, guys. So this is what you're going to do. You're going to cleanse your skin. So any type of gentle cleanser that you have at home, have it be the Restore C cleanser, the Cleanzyme cleanser, anything that is considered gentle and no active. So no salicylic acid, no glycolic acid. Could you use the derma roller in their hair with the hair growth serum? Yes, you can. You can definitely do that. And I know it sounds a little bit challenging to use a derma roller in your hair, but if you want better results, that's what you have to do. But back to the skin. I know it's so easy to go back and forth between skin and hair for these vials. So what you're going to do is you're going to cleanse your skin, use that gentle cleanser. Again, nothing with actives, no glycolic, no salicylic acid, nothing like that. And then what you're going to do is you're going to lightly roll this all over your skin. So that's what you're going to do. If you have a problem area, you can kind of go a little bit more over that to get a higher concentration of the stem cells. And then directly afterwards, what you're going to do with this roller is you're going to start rolling it in to your skin. Now, a lot of patients say, I'm really scared to use a derma roller at home because there's needles, it looks terrifying, how do I clean it? Guys, we have step-by-step instructions that you can use. So if you're worried about derma rolling at home, if you're worried about causing damage, you just need to learn the correct way to do it. And you can easily do that by booking a consultation with our esthetician. She can go over how to use microneedling, the frequency of microneedling, which by the way, you should do about once a week. If you have super tough skin, you can do twice a week, but the general rule of thumb is if you're rolling with a 0.5 millimeter roller, do it once a week because it's really beneficial for your skin and some collagen production. So when you're rolling, make sure you lift up the derma roller every time you make a pass. So this guarantees that you're not rolling over the same skin and making the same micro injuries in the same areas. So as long as you pick it up, it works fantastic. And then after you do everything vertically, you can go and do everything horizontally. And of course on your nose, you can do this. But this way, this derma roller creates microchannels so the stem cells can actually get into the skin and do the job that they need to do. So it's really good if you have acne scarring at home, or if you have fine lines and wrinkles, or if you have dark circles underneath your eyes, which by the way, we have a derma roller specifically for under eye use, just because the skin's a little bit more fragile in that area. it's going to help with collagen production. And guys, if you're doing treatments, with Dr. Emer or your own dermatologist or even an esthetician, this is a great at-home treatment that you can do. So it's like dieting hardcore at home while you're seeing a personal trainer. So if you do both, you're going to get so much better results. So again, guys, what we kind of been talking about, if you're just joining us, is this AnteAGE Microneedling Solution. So this is specifically designed to be microneedled into your skin. And like I said, it comes, each of these boxes, so let me open it for you, comes with 5 little vials. So of course, one of the vials is right here. And like I said, it's super easy, guys. Just keep it in a nice area. You don't want it too hot, too cold. But like I said, it has a high concentration of stem cells. Guys, if you're looking at something new for your skin to give you kind of like that extra bump, especially with wrinkles or, like I said, acne scarring, this is a great way to kind of get a bump at home. So it's really easy, it's super simple, and when you use your derma roller at home, make sure that you're cleaning it with alcohol before and after every use. Granted, I clean it much more than that, but I'm also a germaphobe, so that's one reason why I do it. Let's see, I don't think I missed any questions. Could you use the derma roller? Okay, I already answered that one, so yes, you can. Give respect to the community. Black Lives Matter. Absolutely, 100%. Let's see. Oh, you're not really having any questions today, guys. I'm disappointed. Love how you're presenting this. Oh, well, thank you. I'm definitely just go off book. I hope I give you guys all the information you need. But again, guys, so this is a great treatment to do at home. So if you're worried about pores, like I know if you watch me consistently, I always talk about pores. Because honestly, it's like the one thing that kills me, because I do so many treatments, I use a lot of skincare, and then I still get some pores on my nose, which are genetic. It runs in my family, so I know it's a problem. The microneedling with the solution really does help my pores. Now, is it going to substitute treatments with a dermatologist or an esthetician? No, but it's going to complement all the treatments that you do with a provider. And this is one of the most aggressive treatments that you can do at home that will benefit your skin. Does it help with hyperpigmentation? So it can, depending on the skincare that you use. So for some of our patients that have like melasma or they develop pigment incredibly easily, what they can do is you can use the Jan Marini Luminant Mask, which helps brighten the skin and it helps with the hydration of the skin. So you're gonna put that over your skin, you're gonna wipe it off, and then you're going to derma roll right afterwards. So that is going to help with pigmentation, but again, you just have to be using the right skincare. But if you do have pigmentation, just make sure you're using like a hydroquinone, you're using a retinol, you're using, a vitamin C serum in the morning, you're using a kojic acid in the morning. There's a lot you can do. Are you red the next day? Oh, hello. So yes, sometimes you can be red. Now granted, if you derma roll with the anti-aging solution, you're not going to be as red and you're going to recover much quicker. So I tend to do this on Sunday nights, and typically on Monday morning, no one can tell that I even derma rolled at home. Sometimes my nose is a little bit red, but that's just the way my skin reacts. So more than likely your skin will be fine and no one's really going to be able to tell that you did anything. But I always tell patients, choose a specific night each day of the week that you're going to derma roll. So I tend to remember Sunday nights a little bit better because it's right at the end of the weekend. So that's when I tend to derma roll. How long would a vial last? So for me, depending on what concerns I have, typically I'll use half a vial per application. Now I know some patients that are super aggressive, they will use a full vial. So if you're doing this once a week and there's 5 vials, it's either going to last you 5 weeks if you want to use the whole, or it can last you 10 weeks. So, but remember, this is a high concentration of stem cells and it has 2 more types of stem cells. It's hard to say, I kind of get tongue-tied. That kind of fortify the formula to make it that much better. So, let's see, how long would a vial, okay, I just answered that. And how soon after a peel can you do it? Is it okay to do in between treatments? So yes, this is the perfect procedure for you to do at home between treatments. Now, in terms of the peel, there's so many peels on the market. I don't know if you're talking about like a VI peel, if you're talking about the Cosmolon peel, if you're just talking about a typical phenol peel or a TCA peel. Typically the rule of thumb is whatever the downtime for that peel, double it. So say for the Enlighten peel, my patients recover in about a week. So I would tell a patient wait 3 to 4 weeks before derma rolling. Okay, I want to order and ship to Canada. Yes, we do ship to Canada. I know that for a fact. So you can definitely order it. All you have to do is look up AnteAGE. But remember, if the AnteAGE, we do have 4 of their products. So we have the AnteAGE Growth Factor Serum, AnteAGE Accelerator, and then we have the AnteAGE Ampules, which is this microneedling solution. So if you're interested, make sure you're getting the right one and it displays this picture. All right, do you guys have any other questions? I'm just so excited I get to do this from the office, so I'm not in my bedroom doing this. It's exciting. But hopefully I answered your peel question. But if an esthetician is doing your peel, then you feel free to ask them, say, hey, I have a 0.5 derma roller at home that I'm using. How long should I wait? So guys, if you're making a drastic change in your skincare routine, I highly advise consulting your esthetician or your dermatologist or booking a virtual skincare consultation with us. So we can answer all of those questions. We try to take all the guesswork out of skincare because, you know, there's a lot of science behind skincare, guys. And if you don't have a guide to guide you through it, it can be confusing, it can be overwhelming, and you could be doing more damage to your skin than harm. Or for whatever concern you have, the skincare you might be using might not even tackle that concern, then you're gonna get frustrated. So that's where we kind of done all the work for you guys. We want you to have great skin. And the first part of getting great skin is getting a good foundation with your skincare. I can't tell you how much my skin has changed since I've started using medical grade skincare versus the skincare that you get in department stores. Thumbs up, yay, and hello from Iran, we're here in Beverly Hills. But I don't know if you guys have any more questions, but I really can't stress enough that, guys, once you get that great foundation for skincare and then you start adding on lasers, your skin is going to be great. But it's a commitment. So everyone always thinks lasers, you just do one laser and your skin is going to be absolutely amazing and perfect and glowing. And if you already have great skin, then yes, you can do that. But if you have problematic skin, then it's going to require a little bit of a routine. It's just like going to the gym. You just need to work towards it every single day. But good skin is, you're able to get it. Who's this guy? So I work for Dr. Jason Emer. I'm one of his patient consultants. So I help patients decide which treatments they want to do that Dr. Emer recommended. I help them with skincare. I help them book their appointment. I help educate the patients on why we're doing certain lasers and why certain skincare is suggested. So I'm kind of like a beauty guru, and I kind of help guide my patients to where they want to be. So my job does kind of encompass a lot, but I was trained specifically by Dr. Emer, and I know of his protocols, so I can definitely help you with your skin. But guys, remember, if you have, you know, any questions about skincare, if you just kind of don't know what to do for your next appointment, you know, feel free to book that consultation. We're doing our virtual consultations. We're finally back in office, which I can't stress how excited I am about that. But again, guys, when it comes to skincare, don't do the guesswork, do your research, and then let us help you. So it was fantastic talking to you guys. Let me see, can you talk about the Faith Lame Labo line? Awesome, so I'm glad you know about that line. It's not very popular in the United States yet. It should be, because it's a fantastic line. It's great for sensitive skin. So if you have, really sensitive skin and like you can't use retinols and like you get really weird reactions to regular skincare, Faith by Lame Labo is a great skincare line to look into. And we do carry the full line. So if you just type in Lame Labo on our website, you can find it. So it was formulated in Japan. So some of the translations are a little bit funky, to where it says, like one of them is Lame Labo Moisture Lotion, even though it's not a lotion, it's a serum. So do keep that in mind when you're researching this line. But they have two great cleansers. They have a gel cleanse, which if you wear heavy makeup, the gel cleanse is amazing for taking off makeup. And then they have a clay mask, which I've used before, and I actually leave it on my skin for a couple minutes and actually use it as a mask, but it is a cleanser. So it's quite fascinating. They have a hyaluronic acid serum. They have a light moisturizer, a heavy moisturizer if you have dry skin. So guys, look up Lame Labo. If you have sensitive skin and you can't find other skincare that doesn't work for you, try Faith by Lame Labo. They're a great line. We carry it. I don't know of any other place that does, but eventually it's going to catch on in the United States because it's really amazing skincare. What can you do for dark acne scars on the body, chest, shoulders, and back? So if we're just talking about the pigmentation that comes with the acne, I highly suggest a chemical peel. So we have the Cosmelan peel and the Enlighten peel. Both of these peels are going to attack that type of pigmentation. Now, if you're still getting acne, I highly advise taking care of the acne first, because you don't want to correct all the pigmentation and then get more breakouts, so then you're just going to have to keep repeating the process. So get the acne under control and then attack the pigmentation. But that's about all the time I have today, guys. Since I'm back in the office, I don't have as much time as I normally do. But if you do have any other questions, please feel free to DM Dr. Emer. Get that consultation, that free consultation for skincare online. You can book one for the Aesthetician, or you can do a virtual consultation with Dr. Emer himself. And you can find all of that on our website at emeragecosmetics.com. All right, guys. It's always a pleasure. I'm going to continue to do these lives in office. So tune in on Friday at 4 p.m. for my next one. All right. Bye, guys.